Hello. I have no slides, so I'll just let you know about that. To begin my remarks, I begin first with a land acknowledgement. The District of Columbia sits on the ancestral lands of the Anacostans, also documented as the Nanatochek. This district shares its borders with Maryland and Virginia and connects along the lands that house the Anacostia and Potomac River. These river systems were the homelands of sovereign people, the Piscataway, the Pamunkey, the Nintango, also known as the Noachek, the Mattaponi, the Chickahominy, the Manacoan, Powhatan, and the Patawomic people, the namesake of the Potomac River. As we enjoy this conversation today, let us be aware that we are in dialogue on their homeland, and let us recognize that their presence is imbued in this space. Today, the indigenous people that reside in the Washington, D.C. area continue to present their case for recognition. These citizens fight for their nations, hoping to restore or receive government-to-government relationship with the U.S. In Virginia, 11 have achieved state recognition. The Pamunkey tribe, which received federal recognition just in July 2015, recently acquired its land and is one of only 2 Virginian tribes that own land after colonization here in present-day Washington, D.C. And recently, just 6 tribes in Virginia were currently federally recognized. I'm Vanessa Hiratsuka. I am a member of the Navajo Nation and am a Winnemem Wintu on my maternal side. I'm a tribal member of one of the largest tribes in population and also in physical size with our reservation that spans 4 states. I was also born for a tribe whose legal rights were terminated along with many other California tribes in the last century. I'm also an Indigenous mixed methods researcher who conducts empirical, legal, ethical, and social implications research as a researcher based in a tribal health organization in Anchorage, Alaska. Why do I mention federal Indian law at a bioethics conference? In this session, we just heard from a powerful scholar and researcher, Dorothy Roberts, and both of us have been asked to speak on this topic of understanding the impact of inequality on health and disease and who participates in research. And we are in dialogue with you through the facilitation of another wonderfully powerful scholar. I am humbled in joining these scholars today. I know when we were on our planning call, I asked, why me? Because there are so many wonderful people that speak on this topic, and I'm here and allotted this time to amplify the voices of the communities that I come from, the people that I serve, and those that I am allowed to partner with and research with. The American Indian Alaska Native context has the distinction of being both a racial grouping and a political entity. The concerns of American Indian Alaska populations also will sound quite familiar to the concerns of so many others. As a previous scholar, Dr. Mello, had spoke, the bioethical issues in this session, sessions 1 and 2, are very similar to other bioethical issues, despite being of diverse populations. There are some unique and important differences, and again, that political designation comes into play. As of February 19, 2020, there are 574 federally recognized tribes by the Bureau of Indian Affairs here in the United States, and 231 of those are in the state of Alaska. That list of 574 tribes are on this list called the Indian entities recognized and eligible to receive services from the United States Bureau of Indian Affairs. Most recently, the Little Shell tribe, Chippewa tribe of Indians became the 574th to join that listing. The American Indian tribe is the fundamental unit that the Constitution grants Congress to the right to interact with. Tribes are sovereign nations with the inherent right to self-determination, including the determination of how and what kind of research might be conducted within their communities. Now, I just want to say this little thing of, I completely support tribal sovereignty, which is often expressed in self-determination. But it should also be noted that what can be granted can be taken away. The application of the principles of federal Indian law by the federal government has also resulted in the undermining of tribal political and cultural sovereignty. This has included terminating tribal recognition, denying tribal rights to ancestral lands, denying rights to engaging in cultural practices, preventing access to sacred lands and waters, prohibiting tribal authority over non-members in land use situations, prohibiting tribal resolutions to criminal violations committed by Indians on that Indian land, and prohibiting tribal governments for persecuting non-Indians who commit crimes on Indian land. It is through federal Indian law that American Indian and Alaska Native people are subject to extensive legal regulation of their rights. This has resulted in deliberate and unintentional intentional historical trauma, a collective and emotional psychological injury over both an individual lifespan and across generations, resulting from these historical difficulties that American Indian and Alaska Native people have experienced as a group. Contributors of historical trauma include assimilation policies and programs that have separated American Indians and Alaska Natives from their families and tribes, and denying access to sacred lands and cultural practices. These things have led to a variety of health disparities, massive gaps amongst this population and that of general Americans and other minority populations. Through treaties and later public law, tribes have received healthcare services through these federally funded organizations, first via the Department of War and later the Department of Health and Human Services through the organization known as the Indian Health Service. And more recently, tribes are able to enter into direct compacts and contracts to deliver healthcare services themselves, exercising their self-determination and exerting their sovereignty. For example, this American Indian Self-Determination and Educational Assistance Act allowed direct funding of tribes to administer their healthcare services as an alternative to accessing chronically underfunded services through the Indian Health Service. These tribally administered programs have been remarkably successful, and in that have created huge leaps to improve the health of our populations. Along with that, we were able to have passed the Indian Healthcare Improvement Act, which sought to improve current healthcare services, increase services available to urban-dwelling American Indian and Alaska Native people, and promote education and retention of health professionals to work in these tribal communities. Now, across the time periods, American Indian and Alaska Native people have been subject to many missteps and mistreatment by the research community, social sciences, clinical services. Transgressions in ethical conduct of research have ranged from failures to be inclusive and transparent, share research results and other benefits, or respect group and individual rights and confidentiality, stigmatizing those people and violating cultural values. The path from research to tribal health benefit is long and uncertain, and may seem just extra given that some American Indian and Alaska Native communities have limited access to basic medical services. And again, that systematic underfunding of the Indian Health Service contributes again to these ongoing long-term generational health disparities. The small size of some of those 574 American Indian and Alaska Native tribes, and in cases unique genetic profile, increases the prospect for community identification and stigmatization, of which many examples exist. Furthermore, tribal sovereignty, rights, and values may have implications for study review and approval, participant recruitment and consent, return of results and data sharing, storage and stewardship that fail to align with current national policy and American individualism. Due to the harms that have occurred in many studies, there is quite a bit of skepticism from members of the American Indian Alaska Native community and those that govern our communities in engaging in research. I'm just looking through my comments here and I'm trying to make sure that I fit within our time period. I see I have 2 minutes and 34 seconds left. So I'm just gauging here because I wish to acknowledge Dr. Allen's request of touching upon some of our research as well, in addition to this context. To benefit the fruits of health research, tribal communities and tribal members are currently deliberating so deeply on whether and how such communities and individuals wish to engage in research. Concerns about the kind of comprehensive long-term data collection envisioned in programs like the National Institutes of Health conduct of the All of Us Research Project, and how that information might be used or misused are strongly salient given that history of racial discrimination, termination of tribal status and associated rights, and possible threats to tribal enrollment of individuals. In addition, it's very difficult to know what is best and how to operationalize respect for both tribal authority and individual autonomy of tribal members in research, how to safeguard and protect from physical harm, and at the same time balance the protection of group harms. Against this backdrop, we've been conducting individual research at Southcentral Foundation, the organization that I work for. This research, the scholarship, has been largely funded through the set-aside through our ILSI programs. I would like to talk a little bit about that, but I also wanted to just briefly touch upon community-level review of research. Before we went about conducting research in our organization, the tribal leadership, the governance, had developed a additional process, additional to human subjects review, community-level review of research. And it was only after that process was in place that we began doing research that is in alignment with the tribal priorities and values of that community. That consensus building set of activities, the long-term partnerships, even with researchers that are embedded within the organization, was something that was quite necessary before we could go about doing our work. For the past 12 years in the empiric research that I've led, Alaska Native people have described to me and to those large partner organizations that I work with that indeed they're quite interested in participating, that there is benefit, but that ongoing community engagement is required. Tribal academic partnerships do absolutely offer rich bidirectional learning and mutual benefit. But research must be conducted when it is under the authority of those tribal nations, when it is self-determined, when it is in alignment with the values of that organization. And that some practices that might be standard elsewhere are not going to be happening under our authority. Those might include things like non-tiered broad consent, storage of specimens in national repositories, documenting pedigrees, genome-wide sequencing, no return of individual results or collective results, stigmatizing language. We do pre-publication review, and again, just determining how a research team and who the individual is and what they're doing and why they're doing it is a way to enact tribal sovereignty. I am so sorry, I'm a little bit over time, and I will conclude there.